So this is a study looking at the association between sarcopenia and falls and fractures. So it starts off talking about the background of sarcopenia, registration of the trial, goes into inclusion criteria for the study. So people had to be over the age of 65, diagnosis of sarcopenia using one of the standard definitions, and then the outcomes had to be falls, fractures, or falls and fractures. And they mentioned that the studies included were heterogeneous, and so they used statistical analysis which recognized that. They also mentioned the diagnosis of sarcopenia, and they said that it had to be either low muscle mass or low muscle mass combined with low strength and physical performance. And they looked at 22 studies, of which 10 showed that there was an association between sarcopenia, falls and fractures. And if we just skid through all of the tables, so significant association between sarcopenia and falls, which was independent of the study design, population, sex, etc. Study quality. And then they said that there was an association between sarcopenia and falls and fractures, but that association couldn't be considered as causal, as clearly people could fall and fracture and then develop sarcopenia afterwards. Scooting down to their clinical recommendations. So they mentioned that the timely diagnosis and treatment of sarcopenia as a modifiable risk factor for falls and fractures should be recognised, and that current evidence suggests that progressive resistance training improves these risk factors for falls and fractures, but it's unclear whether this type of training would directly relate to the reduction in incidence of falls and fractures. So it looks as though resistance training is as important as balance training in this target population.